Hey guys, welcome back to Science with Mr. Duong. Today I'll be talking to you about my favorite organ, the heart. Now this video is going to be targeted at students who are enrolled in high schools in New South Wales and are currently studying science. This video will have content that are suitable for students of all stages from stage 4 through to stage 6. However, if you're in year 7 or year 9, not all of this is going to be relevant. So one of the reasons why the heart is my favorite organ is because all of the features in the heart are so easily distinguishable. So what do I mean by that? So all of the features, all the things that you can see on the heart are different from other things. Unlike an organ like the brain, which I do know the parts of, but however I find that it's very difficult to memorize or to distinguish from other parts of the brain, mainly because everything just looks the same. And similarly, here's the eye. Now the eye isn't as difficult as the brain, and I quite love the eye as well. However, there are structures that are very similar, like these red bands that are all around the eye. So these red bands are muscles, and they all have different names. See, if you haven't been studying the eye for very long or in depth, you wouldn't know what to be looking for. Okay, so that's why I love the heart, because everything is just so easily distinguishable. Now, if we're going to be talking about the heart, the first thing we need to discuss is its orientation. So let's pretend that when you're looking through this camera here, we're looking at a person who is facing us back, face to face. We're going to be talking about the orientation of the heart. So how do we know which surface of the heart is the anterior surface or its front surface, the front of the heart? Well, if you have a look at these two flaps here, we call them auricles. Now these auricles are a feature that we can use to orientate the heart or to make sure that we're looking at the anterior surface of the heart. The posterior surface or the back of the heart doesn't have any of those auricles. So if you're looking at a heart and you see two auricles, you're facing you're looking at the anterior surface of the heart. Now for its placement on the human body. Contrary to popular belief, the heart is not actually located on the left side of the body. It's not located on the right side of the body either. Some of you may know that it is located dead in the center of the human body. However, this isn't entirely correct either, because the heart isn't just straight along the midline of the human body. Instead, it is in the middle, but instead it's tilted towards the left side of the heart and rotated back. So let's pretend that this pencil here is the midline of the human body. The heart will sit about here. Okay, so majority of the heart is on the left hand side. So this is why you might see doctors putting their stethoscope on the left side of the human torso, is because majority of the heart is on that side. Now when a doctor is using their stethoscope to listen to your heart rate, they're actually listening to these valves opening and closing, and we'll go into that a little bit more later on in the video. So now let's go into the structures, the internal structures and features of the heart. So the heart can be broken down into 4 squares. Now I like to break that down even further to upper half and lower half. Okay, we can also split it between right and left. Okay, if you're wondering why this is the left side and that is the right side, remember that we're looking at the front of the heart, the front of another human person whose left and right are opposite to ours. So the 2 upper chambers here we call the atria. Now atria is plural for atrium. So if I'm just talking about one chamber here, that is one atrium. The 2 lower chambers are what we call ventricles. So here on the right side, we've got the right atrium, right ventricle. On the left side, we'll have left atrium and left ventricle right there. So the right atrium is the first pit stop for deoxygenated blood returning to the heart. So after the blood travels around your body, it supplies your muscles and organs with the nutrients and oxygen that is needed. The blood gets sent back to the heart so that it can be oxygenated again. So oxygen-rich blood comes out of the heart, goes to the rest of the body, and it comes back to the heart through the inferior vena cava here and the superior vena cava here. So both of these veins will collect the blood coming back to the heart and return it to the right ventricle. So the blood fills up in the right atrium. After it's done that, it trickles down to the right ventricle over here before it gets sent off. So after the right ventricle is filled with blood, the heart contracts, or the heart muscles, they squeeze, they tighten up, they move. It squeezes the blood out of the heart. So you may have noticed these thick walls in a different color here. These are your heart muscles. We call these muscles myocardium or cardiac muscle. So when your heart contracts, the muscles contract and push the blood out of the heart. So when your heart contracts, blood from the right ventricle gets sent out. So the deoxygenated blood gets sent out of the heart and to the lungs. So it comes out of the heart through the pulmonary artery. And if you're confused about what arteries and veins do, here's how I like to remember it. It's worked for me for the last 10 years. Now, arteries take blood away from the heart, whereas veins return the blood back to the heart. The A in artery stands for away. Away, arteries away from the heart. It works every time. Now, in the lungs, this is where a process called respiration occurs. And to put it simply, respiration is when oxygen from the external environment enters your blood. Now, after the lungs have done their job and put oxygen back into the blood gets sent back to your heart through these things called pulmonary veins. Okay, so on both sides, left lung returns oxygenated blood through the pulmonary veins here, and the right lung to the pulmonary veins over on this side over here. Now, we've heard the word pulmonary pop up twice in this video. Every time you hear the word pulmonary, it just means relating to the lung. And like many other medical terms, it's derived from a Latin word, pulmo, which means lung. So the blood will enter the heart via the left atrium over here, via the pulmonary veins, which then trickles down to the left ventricle, where it will get pumped to the rest of the body through this big red artery here called the aorta. Now, the aorta is the main artery. It's like a freeway, if you will, supplying blood to the body. Now, from the aorta, there will be smaller branches coming off the aorta, and that will go to more specific places in the body. Now, you may have noticed these white things here. They're your valves. And unfortunately, in my model, some of the valves have been broken. Yeah, they're pretty old, so they've been broken. But if you know a thing or two about valves, not in medicine or in bio, but just in life, valves open and close to let air in and out. In pipes, there are valves that stop water and fluids from coming in and out. In the heart, they do the same thing. These valves stop the blood from flowing backwards because we want blood to flow in one direction. Deoxygenated blood gets sent to go and get some oxygen. Oxygenated blood gets sent to the rest of the body and the rest of the body will make use of it. So as the cardiac muscles contract, it pumps the blood away from the heart. And as it does this, these valves shut close to prevent the blood from flowing backwards, because we only want blood to go in one direction. So over here we have the tricuspid valve. Tri meaning 3. So if you have a look at these 3 little nubs, these 3 bulges, they're the 3 attachments that this valve has to anchor onto the cardiac muscle, giving birth to the name tricuspid valve. 1, 2, 3 attachments. Now the valve attaches to the heart through these strings called chorda tendineae. It's a little bit hard to see, but they're called chorda tendineae. They're basically heartstrings, and colloquially and casually, the chorda tendineae are known as heartstrings. So these provide an anchor point for the valves, and it helps the valves shut open and close as the cardiac muscles are contracting. So the tricuspid valve separates the right atrium from the right ventricle, preventing the backflow of blood. So after the blood's come down here, it gets sent through the pulmonary artery to the lungs, but it has to go through the pulmonary valve. Now the pulmonary valve is exactly as it sounds. It's at the stem of the pulmonary artery. It stops blood from flowing backwards because, again, we only want blood to go in one direction, to the lungs, at this stage to the lungs, to get oxygen. So blood then comes back from the lungs through the pulmonary veins, and it enters the heart through the left atrium, which then travels down to the left ventricle. And it goes through what we call the bicuspid or the mitral valve. Bi meaning 2, and you guessed it, on this side of the heart there are only 2 attachments for the bicuspid valve. So from the left ventricle, blood is then pumped to the rest of the body through this big red artery called the aorta. And yes, you've guessed it again, there is an aortic valve just here. Okay, so aortic valve stopping the blood from going backwards into the heart, because again we want it in one direction to the rest of the body.